Welcome to today's video on physical activity and all-cause mortality, otherwise known as death by any cause. In this video, we'll be looking at the association between physical activity and mortality, how this is relevant for a practicing clinician, and the UK physical activity recommendations. Take a look at these risk factors for all-cause mortality: obesity, diabetes status, high cholesterol, smoking status, hypertension, and low fitness. Which of these risk factors do you expect is responsible for the largest proportion of mortality in the Western world? Well, a large prospective study in the US involving over 40,000 people found that it is low cardiorespiratory fitness which is responsible for the largest amount of preventable mortality. Low fitness is often used as a surrogate marker for physical activity, as it can be objectively measured and is significantly influenced by the amount of physical activity undertaken by an individual, although it is also affected by genetics. This graph shows the population attributable fractions for all-cause mortality for each risk factor mentioned earlier. The attributable fraction is a statistical estimate of the number of deaths in a population that would have been avoided if a specific risk factor had been absent. It could be more useful than absolute risk reductions because it takes into account the number of individuals exhibiting a risk factor as well as the magnitude of the risk. For example, the risk of dying by jumping off a high building is extremely high, but because very few individuals do this, the population attributable fraction is comparatively low. The risk of physical inactivity is comparable to other risk factors such as smoking and high blood pressure, but because the number of physically inactive individuals is high, the population attributable risk of physical inactivity is also high. Furthermore, the research shows that physical activity can reduce the risk of mortality independent of a host of other factors, such as body composition. This is significant since, although anecdotal, it has been noted that if clinicians refer to physical activity, it tends to be because of its potential role in weight loss, when in fact, physical activity is important for longevity in its own right. The reduced risk of all-cause mortality from physical inactivity can be largely explained by the reduced risk of developing a myriad of common fatal diseases. For example, the National Heart Forum commented that physical inactivity contributes to more coronary heart disease than smoking and hypertension put together. Furthermore, the cost of physical inactivity is thought to be large, estimated at £900 million for the NHS and £7.4 billion for the UK economy within a year. Physical inactivity and smoker status have similarly large detrimental health effects. Prevalence of smoking is decreasing, which is largely attributed to successful public health schemes. This begs the question why physical activity promotion is not so much in the public eye. This graph demonstrates that as well as general physical activity, muscle strengthening exercises can also lead to a reduction in risk of all-cause mortality. So how is this data relevant to a practicing clinician? Some research suggests that it is the most recent levels of physical activity which impact on the risk of mortality the most. This means that it's never too late for a patient to become active. In fact, it is most important to improve activity levels when patients are completely inactive, as this yields the largest benefit. Just 15 minutes of exercise a day can add 3 years to a patient's life expectancy. The UK national guidance suggests that adults should receive at least 150 minutes of moderate intensity activity or 75 minutes of vigorous activity each week, as well as undertaking muscle strengthening at least 2 days a week. Time spent sedentary should also be reduced. A good way of explaining this to patients is that moderate physical activity is where an individual can talk but not sing, and vigorous activity is where an individual is too breathless to talk. Thank you for listening. For further information, please see the links presented shortly. Please remember that most patients aren't physically active and that a brief intervention can improve both the quality and quantity of a patient's life.